Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide the COVID-19 update for the week ending Thursday, March 25th, 2021. As always, the first question I'm going to address is how is the pandemic progressing globally in the U.S. and in our region? And then secondly, I want to talk a little bit about the new variants. You hear a lot about that in the news. In terms of the pandemic globally, 2.7 million deaths, 2.3% increase in the past week. That is a reduced number, as you can see, from where it has been, but it's also increased over the last 2 weeks, and that's a little bit worrisome. And also, just to remind you that even at this rate, there were 61,000 deaths last week, which is about 6 deaths every minute. What worries me a little bit is we've seen this undulating so-called sawtooth pattern. But look at the last couple of weeks. There's clearly an increase in the number of daily deaths. And even if that number is leveling off, it is still higher than at any time except in the last couple of months. So while it's down compared to December and January, it's up over the last 12 months, including the spike in March and April. If you look at those countries with 3 million people or more, there are 26 of them that have had over 1,000 deaths per million, including the United States at 1.7 million. 1,700 deaths per million. But the reason I want you to look at this is I'm going to compare this to just about 6 months ago. And what you can see is the U.S. has gone up almost 2.5 times, and it has almost had to triple to even make the list. And so the point of all this is twofold. One, this pandemic is still growing. It is still killing people. And there's no clear understanding of where the maximum number is going to be. But it certainly appears as if countries are moving towards this 2,000 deaths per million number. In the United States, we've had 558,000 deaths and a 1.4% increase over the past week, which is good, a little bit better than the rest of the world. But again, point out that this 1.4 is actually more than we saw last week. And even at this, there's, again, about 1,000 deaths every day and about 1 death every minute. If you look at the U.S. sawtooth pattern, we don't see that leveling off yet, which is good. But again, just to remind you that the number is still higher than it was several times during the summer. And we definitely want to keep an eye on this. August, September, October, November, December, January, February, March. So this is where all the cases have been. And again, unlike how it began as an urban problem, you can see that COVID-19 is increasingly a rural problem across the middle part of our country. I'm a little bit uncertain about our regional statistics, and so I've put a couple of question marks. Actually, Virginia is reporting less total deaths this week than they had last week. And you remember we saw this weird thing with Virginia where a couple of weeks ago they were at 19% and then 12% and then 5%. I think they just had some reporting issues. The other three, and Kentucky saw a significant increase, so I just want to keep an eye on that. But the other 3 states look pretty much like the U.S., in the low 1% range. So again, while the pandemic is slowing down, it also appears to be at least leveling off globally, if not picking back up again. And the same may well be true in the United States. So again, the basic take-home message is this is not a time yet to declare victory, throw our hands in the air, and run around dancing a silly dance claiming that we have solved the problem, because we have not. And one of the issues we worry about are these so-called new variants. So what is a viral mutation? Well, when the virus replicates, when it makes a copy of itself, it sometimes changes a little bit. This is from the WHO. And the more times a virus replicates, whether it's in one person or in more people, the more chance it has of mutating. And again, most of these changes aren't going to make a big difference, but sometimes they do. So think about it like this. We showed you this slide some months ago. But what happens? The virus gets into the body, and then it grows very rapidly. And at some point, if you're going to get sick, you're probably going to get sick somewhere around 5 to 14 days. And then the amount of virus starts to drop as you develop an antibody response. But this is the time there in the circle, we're getting millions of copies of the virus. And that's the time when changes can happen. The virus mutates inside one person. It mutates as it spreads between people. Anytime it's growing fast, it can mutate. And we could call this change, mutate, evolution, drift, whatever it is. But the reason it matters is that when a virus mutates, whether it's SARS-CoV-2 or any other virus, it can change how it reproduces replicability. If it makes it so that the virus doesn't reproduce very well, nothing happens. But if it makes it so that the virus can mutate or can replicate faster than the original, then it becomes a problem. It also can change how it spreads between people, its communicability, and also how serious it is on the host. Obviously, if the virus changes in such a way that it doesn't cause disease in humans, that's good, but it can also change and become worse. And also, the thing that worries us all is it may change how it responds to the host immunity. So whether the person has had COVID before or has been vaccinated, in theory, the virus can mutate in such a way that that immunity no longer protects them. And that's the same reason why we need a flu shot every year, because flu virus mutates. Lots of cases all over the United States, thousands of them. It gets really complicated because there are multiple different types of variants. And you can see that even from January through March, the distribution of the variants changes quite a bit in the United States. And some appear to have increased communicability and increased severity of disease. At least some appear perhaps to have less protection against immunity. So we have to keep an eye on it. The CDC says currently there are no variants that rise to the level of high consequence. And this is good news, but it doesn't mean that this can't happen. There's at least a theory out there that we may be able to maintain immunity even as the virus mutates. And the reason for that is this is the so-called spike protein. That's the target of the initial vaccines. So in order for the virus to avoid the initial vaccines, the immunity from it, it would have to change its spike protein. But the spike protein is also how it binds to the ACE2 receptor, which is how it gets into the human cell. So at least there's a theoretical reason to believe that if the virus mutates too much, it won't be able to cause disease. Having said that, when you have millions of people around the world and millions of copies of the virus in those people who are infected, there are going to be all sorts of changes. So the most important thing we need to do now is get control of the virus as it exists now. And that means people need to be vaccinated. They need to continue to wear masks in public, avoid crowds, and do all of the things that we know work. The pandemic has been slowing down, but it appears perhaps to be reversing and increasing both globally and in the US. And there are new variants that can be significant, both in terms of how they spread and the variation of the disease, and potentially whether we're going to need more vaccines in the future. So something certainly worth watching. A great deal more information about SARS-CoV-2 is on the College of Public Health website. If you know anyone who'd like to be added to our mailing list, please let us know or just forward this video to them. And I'd like to thank Melissa White for helping collate data and Dara Young for editing, producing, and posting this video. And if you have any questions or any issues you'd like to see us address, I respond to many questions every week by email. Some I put into the weekly update because they're of broad enough importance. Thank you for your questions. And until we talk again, please be healthy. Thank you very much.